Hi everyone, my name is Shredda Jones, and my presentation covers the topic of diabetes in the United States and Canada. This will be my final project for CGH 310, Foundations of Health and Interdisciplinary Approach. To begin, we must understand the background and basic information regarding diabetes. Diabetes is a chronic health condition that affects a large portion of the global population. In this presentation, I will be focusing on two types of diabetes, type 1 and type 2. Type 1 diabetes mellitus is an autoimmune condition in which the pancreas does not produce enough or any insulin in order to break down food that is being ingested. It is also commonly referred to as insulin-dependent diabetes and is often diagnosed in early childhood. There is no cure for type 1 diabetes, but treatment involves taking insulin with meals. Type 2 diabetes, on the other hand, is when the body is not utilizing the dispersed insulin effectively. This results in high levels of blood sugar and can cause damage to the body. Type 2 diabetes is often preventable, and the focus of this presentation will be on the prevention of type 2 diabetes. It is important to note that diabetes is a causative factor of many of the following diagnoses: blindness, kidney failure, heart attacks, stroke, and lower limb amputations. The risk of developing type 2 diabetes also increases as a person's weight and physical inactivity levels increase. The prevalence of diabetes in the United States and Canada can help us visualize the impacts on the population and the differences between the two countries. In the United States, diabetes is the eighth leading cause of death and the number one cause of kidney failure, leg amputations, and adult blindness. As of 2024, 38 million Americans have been diagnosed with diabetes, of which 90 to 95% have been diagnosed with type 2 diabetes. In Canada, on the other hand, around 3.7 million people have been diagnosed with type 2 diabetes, which is approximately 9.4% of their population. The average incidence rate of diabetes between the years of 2023 to 2024 was depicted to be 984 individuals per 100,000 of the population. These statistics emphasize a need for more efforts that promote the prevention of diabetes in both countries. For primary prevention for any disease or illness, often focuses on preliminary efforts that can be taken to prevent an individual from developing the disease. For diabetes specifically, there should be an increased focus on healthy eating, exercise, maintaining a healthy body weight, and ensuring low alcohol consumption. By prioritizing good health habits, an individual can set themselves up for a low risk of developing type 2 diabetes. Secondary prevention, on the other hand, focuses on screening, early detection, and changes in lifestyle for individuals at risk of developing diabetes. For diabetes, the early detection or screening options are conducting the following tests: hemoglobin A1C, fasting blood sugar, glucose tolerance, and random blood sugar test. A hemoglobin A1C test measures an individual's average blood sugar levels within the past 2 to 3 months. This numeric value is then compared to normal, pre-diabetic, and diabetic ranges for hemoglobin A1C levels. This can help an individual identify whether their eating habits or exercise levels have impacted their health. A fasting blood sugar test, on the other hand, measures what your blood sugar level is after completing an overnight fast. This also is compared to a normal, pre-diabetic, and diabetic range in order to determine if your pancreas is working as expected. A glucose tolerance test, on the other hand, measures an individual's blood sugar before consuming a liquid with high levels of glucose and after consuming a liquid with high levels of glucose. This also requires fasting overnight before the test, and the values are once again compared to normal, pre-diabetic, and diabetic ranges. Finally, the random blood sugar test can be taken at any time, and if values are detected to be above 200 milligrams per deciliter, an individual is identified to be within a diabetic range of blood sugar levels. For those identified to be pre-diabetic during one of these screening tests, they are encouraged to implement lifestyle changes such as increased exercise, healthy eating, and weight reduction in order to reduce their risk of developing diabetes. Tertiary disease prevention focuses on the management of disease. This is the final step that can be taken towards disease management and control, and works towards decreasing experienced symptoms, side effects, by encouraging patients to adhere to their care plan and follow up with medical specialists as necessary. Another method of tertiary prevention that can be beneficial for individuals that are newly diagnosed with a chronic disease such as diabetes is attending disease management programs set up by community health centers or hospitals in order to help them build healthy habits that promote better lifestyle while living with diabetes. As health is beginning to be identified as a human right in many nations, attention and efforts towards attaining equitable access to health and healthcare is increasing. Organizations such as the Global Fund and Doctors Without Borders work towards providing access to necessary healthcare in countries that lack the resources to provide adequate care to their populations. The Global Fund works to provide funding to support the control and fight against AIDS, tuberculosis, and malaria in countries around the world. Doctors Without Borders emphasizes the importance of access to health care, regardless of geographical and physical boundaries, by sending medical providers to countries undergoing health epidemics or natural disasters in order to treat the members of their population. The works of these organizations and other similar organizations emphasize the importance of global efforts and shared resources in order to attain health equity and decrease disease burden worldwide. Socioeconomic factors can also have an impact on an individual's ability to maintain good health and pursue positive health behaviors. An individual's socioeconomic status in countries such as the United States and Canada have a major say in their overall health and well-being. Statistics from Canada report that individuals from low-income backgrounds have a 2.1 times greater prevalence of diabetes than individuals from high-income groups of the population. And in the United States, there exists a positive association between healthcare and socioeconomic status, thus indicating that the more wealthy an individual is, the more likely they are to have a low risk for developing diabetes. Environmental factors can also be monumental in determining an individual's health and well-being. Environmental factors intersect with socioeconomic factors, and one such instance is the prevalence and existence of food deserts and food swamps. A food desert is an area with limited access to affordable and nutritious food, specifically fresh produce. These areas also lack access to supermarkets, making healthy eating nearly impossible for the local population. A food swamp, on the other hand, is an area that is overwhelmed with unhealthy eating options, oftentimes fast food joints and convenience stores that do not carry healthy food options, forcing people to engage in unhealthy eating. Other factors that contribute to the development of chronic diseases such as diabetes are neighborhood safety, healthcare accessibility, food environment, and experience stress. Lack of safety in a neighborhood both prevents an individual from engaging in physical activity and increases their daily stress levels as they ensure that they are not hurt or harmed throughout the day. Lack of healthcare accessibility prevents an individual from being able to seek primary and secondary prevention for diseases such as diabetes and can also make it difficult for diagnosed individuals to keep up with their disease management. Food environments, as I mentioned before, influence an individual's ability to engage in healthy eating habits. And finally, experiencing stress can cause an exacerbation of symptoms for many chronic health conditions. This slide regarding funding covers a topic of where funding can be accessed or potentially accessed for each level of intervention. Primary prevention of diabetes can be conducted by organizations such as the National Health Institute in the United States, which already funds a lot of research on chronic health prevention programs. Additionally, community health organizations can also impact local populations by providing diabetes and other chronic health condition education for the population so that they can choose to engage in healthy habits. Secondary prevention for diabetes, such as early diagnosis and screening, can be funded by insurance companies in the United States and Canada. As many of these insurance agencies already have a certain amount of coverage for an annual physical checkup and annual blood work, much of the funding required for this is currently being obtained and can continue to be obtained through insurance companies. Tertiary prevention, on the other hand, can be funded by organizations such as the World Health Organization and International Diabetes Federation, as they often provide guidance and funding for the management of diabetes in many countries. These are the references I used in order to complete this presentation. Thank you.